Hi, my name is aureus and I am presenting Staphylococcus aureus. Staphylococcus aureus frequently causes skin-related diseases and consists of invasive enzymes and damaging toxins. Staphylococcus aureus is a permanent resident of the nasal passage, is gram-positive, and forms irregular grape-like clusters and is considered the most pathogenic. Staphylococcus aureus causes folliculitis, better known as pimples. Staphylococci are the most prevalent organism of impetigo. Impetigo is a highly contagious skin infection in children of ages 2 to 5 years and is spread by direct contact. The pathogen enters through some minor break in the skin. Symptoms result from the host response to the infection. Lesions eventually will rupture and form light-colored crusts. Topical antibiotics are sometimes applied, but generally heal without treatment or scarring. Scalded skin syndrome is a localized form of Staphylococcus. There are two types. One remains localized and one circulates to distant sites and causes a separation of the skin layers called exfoliation. Toxic shock syndrome is a potentially life-threatening, causes fever, vomiting, sunburn-like rash, and in severe cases, organ failure, especially in the kidney. Minority of cases are associated with menstruation. Non-menstrual toxic shock syndrome occurs from staphylococcal infections that follow nasal surgery, in which absorbent packaging is used after surgical incisions and women who have just given birth. MRSA antibiotic sensitivity testing shows that all the isolates are methicillin resistant. MRSA can cause life-threatening mucosal illness due to leukocidin toxin, spread by contact on things that are carrying the bacteria. Methicillin-resistant Staphylococcus aureus is an infection caused by the Staphylococcus bacteria. It lives in the nose and skin and generally does not cause harm. MRSA is resistant to common antibiotics. Reservoirs consist of the nose, groin, mucous membranes, and is a permanent resident of the nasal passage. It can cause life-threatening sepsis and enterotoxins that affect the gastrointestinal tract. Spherical, gram-positive, irregular, grape-like clusters that are yellow, pigmented colonies. Aureus means golden and are facultative anaerobes. Staphylococcus aureus grows well in high osmotic pressure and low moisture conditions like the nose. Infections in surgical wounds in hospitals have the ability to develop resistance quickly to antibiotics, for example, penicillin. Virulence factors are molecules produced by the bacteria in which invasive enzymes and damaging toxins that contribute to the pathogenesis. Produces toxic shock syndrome and enterotoxic food poisoning. A mechanism for infection is when organisms find their way from the initial site of infection to normal or abnormal heart valves. The rapid destruction of the heart valve is frequently fatal within a few days or weeks if untreated. Other virulence factors of Staphylococcus aureus is the pathogen secretes a protein that blocks chemotaxins of neutrophils to the infection site. If the bacteria does encounter phagocytic cells, it often produces toxins to kill them. It is resistant to opsonization. If it fails this, it can survive well within the phagosome. Toxic shock syndrome virulence factors is a novel staphylococcal toxin which is formed at the growth site and circulates in the bloodstream. Other Staphylococcus aureus virulence factors consist of surface proteins that promote colonization of host tissue. Surface factors inhibit phagocytic engulfment, biochemical properties that enhance their survival in phagocytes. They also contain exotoxins that damage host tissue or provoke symptoms of disease. They also have an inherent and acquired resistance to antimicrobial agents. Diseases that they cause are MRSA, folliculitis, impetigo, scalded skin syndrome, and toxic shock syndrome. Some signs are boils, which are pockets of pus that develop in the hair follicle or oily hair gland. The skin over the infected area becomes red and swollen. If opened, the pus will drain. Impetigo symptoms are painful rash or large blisters, some of which ooze fluid and develop a honey-colored crust. Cellulitis affects the deeper layers of the skin, are also red and swollen. Scalded skin syndrome affects babies and children and is associated with fever, rash, and has the appearance of a sunburn. Staphylococcus aureus can survive for months on an exposed surface and can be transmitted from person to person. Staphylococcus bacteria can survive drying, extreme temperatures, and stomach acid. Staphylococcus aureus spreads easily through cuts, abrasions, and skin-to-skin contact. Diagnosis used in the lab is coagulase testing. Staphylococcus aureus is a coagulate positive, which is significant because there is a high correlation between the bacteria's ability to form coagulase and its damaging production of toxins, several of which facilitate the spread of the organism in the tissue. It damages the tissue and is lethal to host defense. Diagnosis in the lab is also done by culturing an isolate from a blood agar plate, then using a latex test to identify the Staphylococcus aureus. Latex fixation tests use the patient's antigen antibody immune response. Treatments consist of antibiotics. Strains that no longer respond to common antibiotics are called MRSA. Some treatments include draining of the infection. Prevention of Staphylococcus aureus can be achieved by keeping your hands clean by washing them thoroughly with soap and water, keeping cuts and scrapes clean and covered with bandages until they heal. Avoiding contact with other people's wounds or bandages and not sharing personal items also helps with prevention. There is no current vaccine. Once the skin is infected by Staphylococcus aureus, it stimulates a vigorous inflammatory response, and macrophages and neutrophils are attracted to the site of infection. All humans possess antibodies against Staphylococcus aureus, but does not prevent repeat infection. Antibiotic strains of Staphylococcus aureus have emerged and are difficult to treat. Staphylococcus aureus is most common in the nasal passage and is transported from there to the skin. From there it can enter the body through natural openings in the skin barriers such as hair follicles. In a new clinical research study, mice were given Centrin, specifically SM1S26, which was chosen due to its ability to interfere with Staphylococcus aureus. Of the mice that were inoculated, only 50% of the mice have lived. This is a new study. Research teams are developing biologicals that combine Centrins with anti-staphylococcal monoclonal antibodies in a new class of proteins called MAB tyrants, which could be more effective in neutralizing Staphylococcus aureus. Some interesting information is Staphylococcus aureus can live on towels long enough to be transferred to the next person that uses them. If Staphylococcus invades the bloodstreams, patients may develop an infection that affects the entire body known as sepsis, which can lead to septic shock. Staphylococcus spreads easily through cuts, scrapes, towels, or razors. Food handlers who don't properly wash their hands can transfer staph from their skin to the food that they are preparing.